we want to bring in the Chief Scientific Officer for the Wellness Company. That is the one and only Dr. Peter McCullough. Dr. McCullough, it's always great to have you. I want to ask you about this. I want to get to a cancer question because there's a lot swirling in the minds of researchers out there on cancer. But I want to ask you this first. The University of Colorado football coach, Deion Sanders, he's revealed he's had his bladder removed after learning that he had cancer. He says he is now cured. This is fascinating. They took part of his intestine and did this. This is a pretty much groundbreaking surgery. What more can you tell us about this?
Yeah, it is stunning. I've never had a man in my practice in his 50s have this done. This is a very advanced cancer. Remember, he's had a lot of medical care in the last few years. He took several COVID vaccines, had blood clots, had, near amputation of, his entire leg with blood clots, arterial and venous. Now this, and a report by Anderson and colleagues in medicine and surgery in 2022 has reported since the pandemic increases in very invasive bladder cancer, just like Deion Sanders has, so-called turbo cancer. Not sure if it's due to the infection or the vaccine, but it's clear. It's a clear change in what we're seeing with bladder cancer.
We're reading about cancer treatment, and I'm reading from a lot of the stuff I see by you and others that chemo can actually exacerbate the problem. Chemo, some of the outcomes of chemo can actually make the cancer not just not go away, but make it come back and come back stronger. Tell us about this.
Bladder cancer is tricky. So conventional chemotherapy is typically not used. One of the repurposed drugs, if you will, a vaccine is called the BCG vaccine is used. I think the way Sanders went with complete cystectomy, and now he has one of three choices on how the urine is diverted. I think that's the way to go. We're told that it had already invaded through the wall of the bladder. And so, he's fortunate in the Anderson report, from COVID and the vaccines. The typical person takes about 2 months to diagnose.
But is this problem with chemo pervasive in other cancers as well, or is this just with the bladder cancer?
It may occur with select other cancers. Chemotherapy is, conventional chemotherapy is non-specific. So there is what's called resistance, that certain cancer cells can become resistant through a variety of mechanisms. More targeted forms of chemotherapy that actually direct an agent to kill a cancer cell have, less resistance. The other thing that's happening, and look for this, is called checkpoint inhibitors. So about a third of cancers are cloaked by the immune system. Checkpoint inhibitors like Keytruda, for example, in a sense, reveal the cancer to the immune system so the immune system can take it out.
Interesting. We're hearing more and more about ivermectin, sometimes with fenbendazole for cancer treatment. Why does this work, and how can it replace chemo in certain cancers?
Public's getting frustrated. The National Cancer Institute is behind on this. They need to, urgently have a request for applications and do large-scale studies of ivermectin. Multiple preclinical studies shows it has a variety of anti-neoplastic effects. It's very safe. And then with mebendazole, for instance, which the Wellness Company combines the two in a parasite cleanse, with mebendazole, there's clinical data that cancers improve. And so mebendazole is on the standard list of repurposed drugs for cancer. Many patients aren't waiting for the NCI, and they're going to the Wellness Company.
Dr. McCullough, I have that right in front of me, the ivermectin with mebendazole. And my question is this something if you took it, would prevent cancer? Because that's, I think, what people wonder if they don't know if they have cancer. But we're told we all have cancer somewhere. So no, do not take it as a preventative.
Well, we simply don't know. I tell patients always to consult with their oncologists and consult with their doctors. Until we have more information, we simply don't know. We do know it's safe. The biggest thing for a cancer patient who wants to add this on is to have the doctors review both liver and kidney function and make sure there's not going to be any interactions.
And all this can be done through the Wellness Company and your doctors there. Yeah. Dr. Peter McCullough, this is very exciting. And this is landmark stuff. This is groundbreaking stuff. We are trying new ways, doing new things that we've never done before. And, in some ways, ironically, COVID got us here. Isn't that strange? Isn't that strange?
So true.
Yeah. Dr. Peter McCullough, revolutionary. Thank you so much.
Thank you.